Abdominal arteries are really cool, and we just don't spend enough time on them in this class, and we're also limited by what we can see on our models here. So basically, this is our diaphragm. This is kind of the level where abdominopelvic cavity starts. So everything from this point onwards, all these branches are coming off of that descending aorta, this really big guy here. And so we're going to have separate branches supplying things like our liver, this guy here. We're going to have branches for our kidneys. So those are paired, and they're named based on if they're on the left or right side, and they're named based on what they're supplying. So up top, we have another trunk. This is called the celiac trunk, and this is going to supply our stomach and our spleen. So if we can try to zoom in here, we have, so this really big guy underneath that's kind of covered up, that's still descending aorta. So don't forget about that. But we've got this trunk here with 3 separate branches, and some of them you can see. So we can see things like our left gastric artery, we can see our splenic artery and our common hepatic artery. Those are going to be the guys branching off. This is our common hepatic branching to the liver. And then we're going to have a splenic artery, which is kind of cut off here, so we can't see that one as well. But those are the kinds of things that we would expect to have branching off of our aorta, and more specifically that celiac trunk. Again, we have arteries to our kidneys, so the term renal is used to refer to our renal system or our urinary system. And there's no exception here. So we've got a left renal artery, and then we're going to have a right renal artery. If we move further down, this is where things start to be a little more cut off. So we have gonadal arteries going to the gonads. We don't have the gonads on this model, so I won't ask you those on a test, but just so you guys know the general area, it's going to be at this level here. We've got a little branch here. Other things we can see are these guys. So we're coming on to a really big branch again. So we are now at the level of our ilium. This guy is part of our pelvis. So we've got up top, we've got our ilium. This is part of that iliac crest. So anything at this level is going to be named based on our pelvis, and more specifically based on that iliac region. So what happens is our descending aorta, sometimes called the common aorta at this point, it is going to branch off into a common iliac artery. So again, we have that term common popping up. That means you can expect another split further down the line here, and that is what we do see. So common iliac is going to split into an internal and an external iliac artery. Internal is a little smaller, external is going to continue into our lower extremity, so it's a little beefier. It's got to supply more blood. Same deal with our veins. So rather than having an aorta, we're dealing with that inferior vena cava, and it's going to split off into an external iliac vein and internal iliac vein as well. So to review before we move on to our lower extremity, I would say focus on the biggest vessels that you see. So I want you to understand the big concepts, like the fact that a lot of these arterial branches are coming off of our descending aorta. Things like the renal arteries are easy to see. We can also identify our celiac trunk. So if I stabilize here, celiac trunk is again going to be this kind of messy area where we've got 3 branches splitting off. Things like that are fair game, but any vessel down here where we don't have an associated organ is not really fair to ask. So I want you to focus on the big guys, focus on those common arteries branching off. We've got internal and external branches as well. So any of these major blood pathways are fair game.